Throughout history, medicine has come a long way, but during the Middle Ages, medical treatments were often extremely painful and crude. This period was full of interesting history, art, and philosophy, but medical knowledge was limited. Many treatments were brutal, and without modern anesthetics, patients suffered immensely. In this video, we will explore the top 8 most painful and gruesome surgical and medical treatments of the Middle Ages. 1. Eye surgery. In the early Middle Ages, one of the most common eye surgeries was to treat cataracts, a condition where the lens of the eye becomes cloudy. The process, known as needling, involved using a thick, flat needle to push the cloudy lens back into the eye. Surgeons performed this procedure without any anesthetics, relying only on a cup of bitter red wine to dull the pain. The goal was to clear the patient's vision, but the result was usually an unfocused eye, providing only enough vision to see large objects, like ploughing a field, but not enough to read or perform detailed tasks. The lack of precision and pain management made this a terrifying experience for patients. Furthermore, the risk of infection was extremely high, often leading to further complications or blindness. 2. Metallic catheters. Urinary problems were common in the Middle Ages, often due to diseases like syphilis. To relieve these issues, doctors used metallic catheters, which were metal tubes inserted into the bladder through the urethra. This process was extremely painful, as the tube had to navigate the narrow and sensitive passage. When the catheter couldn't reach the bladder, doctors employed even more painful methods. For example, to treat kidney stones, an assistant would sit on the patient's chest while the doctor inserted fingers into the rectum to locate the stone. Once found, the stone was extracted through the bladder using sharp instruments. This invasive and painful process often led to infections and further complications. Patients endured excruciating pain and often had to face long recovery periods, during which secondary infections were common due to the lack of hygiene. 3. Bloodletting. Bloodletting was a common treatment for many ailments, based on the belief that it could balance the body's humours. Physicians used a lancet to cut open a vein and let the blood flow into a container. This procedure was so widespread that even barbers performed bloodletting along with haircuts. Patients underwent bloodletting multiple times a year, believing it would keep them healthy. However, the practice often weakened patients, making them more susceptible to infections and other diseases. The lack of understanding about blood circulation and the body's needs made this a dangerous and painful treatment. Chronic bloodletting could lead to severe anemia and debilitation, with patients sometimes fainting or suffering long-term health issues due to significant blood loss. 4. Saint Fiacre's illness. Hemorrhoids were another common ailment in the Middle Ages. Saint Fiacre, known as the patron of hemorrhoids, was believed to have been cured by sitting on a hard rock. Inspired by this tale, some medieval doctors sent their patients to sit on the famous rock for hours, hoping for a cure. More scientifically minded doctors, however, used a more painful method: inserting a red-hot iron tube into the rectum. This procedure was not only extremely painful, but also caused severe burns and often led to infections, making the treatment worse than the original ailment. The procedure was based on the belief that cauterization would shrink the hemorrhoids and stop the bleeding, but it often resulted in significant tissue damage and long-term complications for the patient. 5. Trepanning. Trepanning involved drilling or boring a hole into the skull to treat conditions like epilepsy, migraines, and mental disorders. Doctors believed that releasing pressure or bad spirits from the brain would cure these ailments. The procedure exposed the brain's outer membrane, increasing the risk of infections and often proving fatal. Without any form of anesthesia, patients endured excruciating pain. The crude tools and lack of hygiene made trepanning a highly dangerous and painful treatment, reflecting the desperate measures taken in the absence of modern medical knowledge. The procedure often left patients with permanent brain damage or severe infections, and the mortality rate was high. 6. Cauterization. Cauterization was used to stop bleeding and prevent infections by burning the skin or flesh with a hot iron. This method was common in treating wounds and amputations. The intense heat sealed the wound, but caused severe pain and often led to further complications like burns and infections. Without proper pain relief, patients had to endure the agony of the procedure, which sometimes caused more harm than good. The use of fire to treat wounds highlights the limited options available to medieval surgeons and the extreme measures they took to save lives. In many cases, the severe burns from cauterization led to secondary infections and prolonged suffering. 7. Amputation. Amputations were performed to remove infected or gangrenous limbs. The procedure involved cutting off the limb with a saw, followed by cauterizing the wound to stop the bleeding. Without any form of anesthetic, the patient experienced intense pain. The risk of infection was high, and many patients did not survive due to shock or complications. Amputations were a last resort, reflecting the severe conditions and limited medical interventions available at the time. The procedure was brutal and life-threatening, demonstrating the harsh realities of medieval surgery. The lack of antiseptic techniques often resulted in infections that spread rapidly, leading to further amputations or death. 8. Tooth extraction. Toothaches were common due to poor dental hygiene. Tooth extraction was the primary treatment for severe dental issues. The procedure involved pulling the tooth out with pliers, often without any pain relief. This caused immense pain and sometimes led to infections and further complications. Dental care was rudimentary, and extractions were done out of necessity, often causing more suffering than the original toothache. The lack of proper tools and understanding of dental health made tooth extraction a painful and dangerous procedure. Patients frequently experienced prolonged pain and infections, as there were no antibiotics to prevent or treat post-extraction complications. Medical treatments in the Middle Ages were extremely painful and often more harmful than beneficial. Surgeons and physicians lacked the knowledge and tools we have today, relying on rudimentary and painful methods. Understanding these historical treatments highlights the advancements in modern medicine. Thank you for watching this video. If you enjoyed this video, please like and subscribe to my channel, Medieval Mind, for more fascinating insights into the Middle Ages.